A salmonella outbreak possibly linked to eggs that sickened at least 79 people in 7 states. ABC News medical correspondent Dr. Darien Sutton is here to help us understand more. Good morning to you, Dr. Darien. This salmonella outbreak has sent 21 people to hospitals. Fortunately, no deaths. What do we need to know about salmonella specifically?
Yeah, so there's at least 80 reported cases, and it stretches across multiple states, Sinead. We have a map here just to let people know. So it's mainly across the West and the Midwest, states like Washington, California, even stretching over to New Mexico and down to up to Nebraska. This is about 1.7 million cartons of eggs now associated with a possible contamination of salmonella. So what should you know? I've treated many of these cases in the emergency room, likely an undercount because many patients thankfully can go home the next day. So what you have to pay attention to are the common symptoms of stomach cramping, nausea, and of course diarrhea. Now often these symptoms can last about a week, but if they are persistent, if you have significant pain, or if you have any sign of bleeding or any other concerns, you should come into the emergency room.
Okay, so those things are good to know. Let's take a look at the measles. The CDC says that there have been more than 1,100 confirmed cases this year. That is 4 times the number of last year. What can people out there do?
Well, the reason why scientists are so concerned about this, Sinead, is because we are on track for having the highest number of cases of measles since 1992. I know we've discussed this, but right now we're about to outpace 2019 records. And that's so important because that would mean that measles would remain endemic or constantly circulating within our community. So what do parents need to know? That vaccines are the most effective and safest way to prevent these outbreaks. Unfortunately, many of these cases are preventable, and there's at least 280,000 children that are in kindergarten right now not up to date on their vaccines.
Wow.
So it's important to know you can get your MMR vaccine at any point in your life. We try to maintain at least a year and at the age of 4, but it's important for parents to bring their kids in, especially many who have abstained or postponed during the pandemic. It's reasonable. I understand that. Their threat might not have been as obvious, but right now it's really important to know that it's safe and effective, this vaccine. There's no association to autism, and it's the most effective way to prevent measles, 97% effectiveness.
And there was even updated guidance for adults to go back and get it if they hadn't.
Absolutely. If you've only gotten 1 dose, you can't find your dose, or you're not sure, you can talk to your provider. There's possibility of testing, but also as adults, we can get the MMR vaccine to protect us.
Good to know. Thank you, Dr. Darien.
Of course.